Okay.
All right, good evening. Welcome. This is City Council Workshop. Today is Wednesday, April 23rd, 2025. It's 5:15 PM. On the table, we have Councillor Beck, Councillor Mallor, Councillor Hawes, Councillor Fish, Councillor Fournier, Councillor Trimble, Councillor Dean, myself, Council Chair Pelletier. We're also joined by City Manager Deb Laurie and Director of Public Health Jen Gunderman. On the agenda tonight, one thing with multiple parts, the opioid settlement funding plan.
Yes. So, at the last GovOps meeting, Councillor Beck and there were 3 committee members there suggested that we go ahead and move forward, creating a special committee to look at allocating, a portion or some portion of all of the opioid funds, settlement funds. So I also had a couple of conversations following that there was some confusion amongst some counselors about sort of where we are in the whole process. So we took this as an opportunity to come back, reset, so that we could actually look at, get the committee moving if that's where the council wants to go, and kind of take a step back for a moment. So the city is party to opioid settlement funds. We and several other counties and municipalities in the state of Maine. We will be receiving these funds from calendar year 2022 through calendar year 2038. So we're receiving funds over a 16-year period. In total, the city should receive just over like $3.45 million of the total funds. When this initially happened, obviously at the state level, there was the Maine Recovery Council. At that point, the thought is we never wanted to duplicate what the Maine Recovery Council was doing. We wanted to look at and identify gaps. I know that they have issued some funding already, about $13 million is my understanding, correct?
The
grants are $13 million, correct?
Funds.
Correct, so that they have awarded grants for about $13 million at this point. To date, the city has only expended $19,326.64. And we did that for the syringe pickup contract that we had with Heal. So to date, the city has made no commitments beyond providing for syringe waste disposal. And we just executed a new memorandum of understanding with Wabanaki. So that has been sort of identified as priority use for those funds. Jen and her folks came last year, talked to the committee about, from a public health perspective, they had identified a prevention project. This is a space that public health has worked in for decades. They have the relationships with the schools. They understand the issues and the concerns that are happening in our schools. So they came forward with a plan to work sort of in the schools, identify children who are at risk, children who have been impacted by substance use, and supporting them over their, if you will, growing up years, because this is generational money. At that point, the council said, we'd like to do some other public input. So we came back, we said, well, okay, we'll do a whole community listening session. And then it was felt that we should just do some of the committee. So we just wanted to come back and say, that's where we've been. There seemed to be support at that time of the prevention programs. Since that initial conversation, we've had another wrinkle appear. And the newest wrinkle that appeared is that the longtime syringe service provider in our community closed. Heal, Health Equity Alliance. So in the interim, Wabanaki has stepped into that space, and we've talked to the council about, it may be necessary for the city to take a role in that space at some point. And Wabanaki's been pretty clear that, this is not, it's not part of their mission to be the broader syringe service provider in the community, but they're doing this to fill the gap and the need. And I think we've talked about the fact that they're relocating to space. They have some additional space where we're going to help with the support and the wraparound services. These are pieces of information that we've gleaned through our work, through our Maine Healthy Access Foundation grant, where we've worked with individuals who have lived experience, who have said, I want to be able to do sort of a one-stop. I need to be able to get assistance. How do I sign up for MaineCare? I need to be able to get assistance to say, okay, today's the day I want to enter treatment. Well, let's get you there. Oh, I need to do just a general, I have a wound care I need to take care of. And that was sort of the vision for that one stop. So we've agreed, at least in concept here, that the city would play a role in that. So those were our thoughts, is that sort of the space where public health has the most expertise and experiences in that prevention and in supporting that harm reduction. So if anything I have said thus far is not in keeping with what the council was envisioning, it would be really helpful, because clearly we're committed to the syringe waste pickup. Are we committed to us partnering and helping Wabanaki have a more robust syringe service program, with the eye of, we are using this as our opportunity to say, if we have to step into this space, it's our learning opportunity to learn from somebody who's been in this business a long time and has been a really responsible provider of services.
Could I just add a couple of other things for context? Is one of the things that we've used as a foundation in understanding this is the 4 pillars that the Maine Recovery Council uses. And that is in addressing the issue. It's a.
Point of order.
pillars.
I hate to do
Yeah.
this, but you weren't recognized.
I'm sorry.
I mean, that's where we are, Robert's Rules of Order, and there wasn't
My apologies.
recognition.
Counselor Beck?
Yeah, and frankly, I'll say the only thing that's been agreed upon was that the Government Operations Committee, we agreed to the committee, and I'm not sure why 1B and 1C are even on here. That's a discussion I think is better had with the special committee. Once we've got all the experts assembled, I think that's a chance for them to present to them, and if they agree, they'll certainly
Okay.
send that back our way.
So can I ask, so your intent of the special committee is to have them have complete control over that pot of money
Yeah.
and how it's allocated?
Well.
Okay,
you know
that
what?
wasn't
Well,
clear.
Well, correction, I want them to bring the action plan forward, we always,
Okay.
we have the.
Yes,
the
yes,
control.
yes, I'm sorry.
Right,
Yes,
but
yes.
I want them to
Yeah.
have the say in it, I want
Okay.
it to come from them.
Okay,
Because my
that's the piece
understanding,
I missed.
right, because I recall that the prevention piece was brought forward, and that was gonna be 100% what it was gonna be, and then there was some pushback
Right.
with council, and then it became, well, we'll go out, and this is something I was part of asking for as well,
Right,
to go out to the public and have a hearing about it. But my takeaway from government operations was, we've decided that this has gotta be a committee, and let's go forward with that committee, and then the rest of it can go through the committee.
perfectly
Counselor
understood.
Trumbull?
Oh, just a point of clarification, I didn't know a committee could create a committee. Is that, the committee created a committee? Doesn't the council have to create a committee?
That's why it's here.
Okay, well, just somebody just said they created a committee.
They made a
Okay.
recommendation.
Okay,
Mhm.
so we've got to decide on that.
And with that point, then if that's where this workshop needs to be, and that's perfectly fine, and we'll await direction from you all as the council.
Counselor Dean?
I would like prevention to be defined. I think there were some miscommunications as to what the prevention is. And maybe from like a layman's term, if you could just describe how this prevention would benefit. A lot of people, I think, are thinking it's just going to the schools and discussing what drugs can do to your life, but it's more than that. So if we could maybe have clarification.
I'm sorry, I just want to make sure that I'm following Robert's rules. Do I have to be, is there a certain direction that I need to have before I can speak?
No, she's asked you a question.
Oh, I
What's your
can ask a
question?
question. Okay, I just want
yeah.
to make sure I'm following rules correctly.
Only, I should probably say, we received a lot of emails. And I think everyone's a little confused.
Sure.
About this
So
prevention.
the program that we're proposing, we've actually kind of given a little bit of a working title called Project Thrive. And it is not doing education on drugs in the schools. It's actually based in the idea that when children and families are supported with linkage to support services, with early intervention, with wraparound services and mentoring and peer support, that it increases the likelihood of a self-sufficiency, healthy homes, healthy families, and actually reduces the risks of adverse childhood events. So the proposal is not to do sort of 101 drug education in the schools. This is about an intervention program in supporting families impacted by substance use disorder to foster healthy, happy families in a number of different ways.
Other comments from council?
But, the committee or this whole,
About the
Everything?
memo, yes.
yeah, I'd like to talk about the committee a little bit, I guess. I've got a question too. So the 3.4 million over the 16 years, we've expended 19. What have we got so far of that? Are we a little over 200,000 or?
No, after the expenditures, we have 1,053,000 right
Oh,
now.
right now,
Because
okay.
the settlements have come
There's
in
a lot
in
up
different
front,
ways.
okay.
Some came in all up front.
Yeah.
Some are tiered over
Okay,
time.
so we've still got over. a
Yeah.
million. Okay.
Yeah.
My question, so, the question for Jen on this, so at this point, I know the Attorney General gave some money of his money to this group, I think at USM, the Catherine Cutler Center for Substance Use Disorder Collaboration. And, that, they, would assist cities free of charge to help them in the process, how to spend the funds. Have they assisted us at all in this process?
Yeah, so we have met with them, gosh, maybe 2 or 3 times.
Okay.
It's the Moss Center, and you're
Mhm.
exactly right. They were given some funds to help support municipalities and counties that have received some of this money. They help provide technical assistance, guidance, look over proposals, provide direction, tools. And so they would be an ongoing partner for municipalities.
Okay, so I guess we're going back to, I wasn't able to attend that meeting, but I'm, well, prior to that, I know we got a lot of emails or people kind of saw some sticker shock of this $30,000 expenditure for listening sessions. That's how they read it anyway. So that seemed like a lot. I understand it's actually probably close to 18,000, as I understand it, but I can be correct me, but, whether that's accurate or not, I'm just confused what the purpose of the committee is. I mean, it seems like would be the council's role. Why it would be, looks like we're creating another layer. And they're just a committee that would make recommendations to the council. I'm just, does anybody know what the purpose of the committee is, why we want to give up our?
The purpose of the committee, the idea was to make sure that people with direct lived experiences had a say in the monies that were being received by the city of Bangor, how they were going to be used. And to quote a lot of people who've told me this term or phrase, this is effectively blood money that we're receiving. People died because of these drugs that were peddled into our community and so many other communities across the country. And a lot of community members feel that us making decisions without the input of those with lived experiences or people with indirect experiences and subject matter expertise to not have their input on these matters. It's just alienating the community that was harmed by the opioid epidemic more than anyone else. But 2, it also creates a bias on the council to go forward with priorities that may or may not even work. The best way to go forward to spend this money appropriately and ethically is to include those members of the community. And this is a committee that can allow us to do that.
Other counselors? Okay, do we have a motion?
I'll make a motion that we move forward with this advisory committee, as laid out here in the memo.
Second.
I would speak to just what I'm opposed. I mean, I understand what's been said. I think anybody with lived experience as not can come and speak to the council about how we spend the money. And I actually just think it's going to create another layer and slow the process down of getting the money out. I want to see this. I've been pushing to get this money out. I want to see it get out. So anybody can speak to the council about how we spend the money. I don't see the need for more committees.
I'm not opposed to the committee. I think it would be one of the first that's the more directed type of committee, considering it's that one pot of money that they're looking at. I don't see that they're gonna slow the process down because too want to get the money out there and get some good use out of it. They are an advisory committee. If you looked at the membership, I assume the motion included the makeup of the
Yes.
committee,
Mhm,
okay.
mhm.
So there's a lot of there's a lot of expertise and ideas to be shared, and I believe they'll help make some decisions. I'm not saying they couldn't come and talk to the council, but we all know that when we have a room full of people here talking about anything, whether it's this or fresh start or whatever it is that we're dealing with, you have to be in the line of sight. It's hard to get the people's comments in and do anything constructive in that meeting. This way they'll have the meeting, they'll have their space. I think it's a good idea and worth trying it.
Counselor Fish?
I think the idea of a committee, to help us address, substance use disorder is a great idea. I think it's a bit more confined than I'd like to see. I mean, is this just going to be, addressing the opioid settlement funds to advise us? Or why couldn't, there be, there may be other things we don't know about right now. Maybe the initial task would be this, but why wouldn't, we have a huge problem in Bangor that we don't seem to be really getting a handle on. So if we're going to put this kind of a task force together, and I like the makeup of those, why would we confine it to just the opioid settlement task?
Counselor Fournier?
I'm going to go back to what staff had originally recommended, just having a facilitator to bring in all the people who have been obviously affected by the opioid crisis. If we go ahead with this committee, I would strongly recommend that we have an outside facilitator come in and listen to the people who have been directly affected. I thought that was a very good idea. I don't know if everyone received the email that we got from Pat Kimball, but I have a lot of respect for Pat. She's been through this process, and I would strongly advocate that we take that direction. If either one, if we go with the committee, and if we go with the committee, I want to bring in a facilitator to help with that process. And if we don't go with the committee, obviously take staff recommendation to go forward.
There is doubt, so we do need to do a vote. Any other comments before we vote? I'll just say, in solving problems, I think the people closest to the problem are often the people closest to the solution. So the more voices with lived experience we can bring together, I think the more effective our use of funds is going to be. Take a vote on the motion to create the committee. Counselor Leonard?
Yes.
Counselor Beck?
Yes.
Counselor Mallor?
Yes.
Counselor Hawes?
Yes.
Counselor Fish?
Yes.
Counselor Fournier?
Yes.
Counselor Trumbull?
No.
Counselor Dean?
Yes.
I'm a yes.
Perfect.
8-1.
So we will have the council order on Monday night that's reflective of this in our order form, and that will also, I will ask for a point of clarification just to make sure. So like when we did it for the Parks and Rec, you kind of asked us, could we throw out some potential names? Would you like us to do that as well this time for you all to kind of decide about when you want to nominate folks? Would that be a helpful starting point? I'm sure you all know people, but we're happy to throw some names out there
Sure.
too. Okay. Thank you.
Thank you.
Counselor Dean?
And where does this leave the original proposal? In the hands of the new committee, or is that
Yes.
something we're circling back?
Yes, yeah.
So that will come up again once they,
If that's the direction, we can certainly provide them that information and go from there.
Even we've created the committee, but we still have this amount of funds. This could still be done similar to the ARPA funds where we took
Yes.
some funds. I mean, we could set aside a pot of money we could still fund these other things that the council wants to fund. And then say the committee's gonna have say over this amount of money, and if they can take, you know, applications for that amount of money. I mean, if we wanted, we're still gonna do the needle exchange, that comes out of money. And if we wanna do some of these other things, the committee can look at these things as well, some of the bigger picture things. But I thought they were gonna do more like take applications, some things outside what the city wants to do. Are they gonna look at what the city wants to do as well?
Yes.
That's what I heard. I mean,
Okay.
that's what I gathered
Yeah.
from this conversation. Yes, is that all proposals beyond those that we've in essence already committed to
Okay.
would be funneled through the committee.
Okay.
That's how I.
Yeah.
And then whether or not, to your point, if they were to come back and to say, we think we should do a grant program, we think we should offer $200,000 for grants for a particular purpose.
Right,
I think, and that would come back to the council, and then you all would agree or disagree that that's the process you wanted to move forward to, because to your point, it's an advisory committee. And all of their work will be recommendations to you all as a body. Well, I have you, what was it, LD 1687. So the legislature now has no rules. They have, things are getting scheduled left and right. And they've made a determination, I think they've made a statement that everything has to be heard by May 9th.
That's what
I
the
think is
mayor's
what they wanted to get
coalition
through.
said, yeah.
So there was a request, it was to support a request for additional funding related to HIV and PrEP testing. Is that correct?
Yes.
Yeah. So it obviously groups that we've been working with for a while, and with the pullback in federal funds, we'd like to kind of throw our support to that particular LD. Okay.
are you talking about the HIV testing, and I know it's not on the agenda, but anything new with the cluster, Jen? The status of the HIV cluster? Oh,
So
it's not called a cluster anymore, right?
an
It's not-
outbreak.
Okay,
We continue to see increasing numbers. And we continue to work as a collaboration. We're seeing some significant challenges right now with plateaus in testing. So we've been offering incentives. We've been offering self-test kits. We're working with a lot of local organizations and hospitals to break down the barriers. The other big challenge right now is medication adherence. And so again, working with PCHC, Eastern Maine, Northern Light, to break down as many of those barriers, because what we know is when someone stays on medication and they become virally suppressed, they live a healthy, happy life and they can't transmit. So right now, you know, housing, there's a lot of challenges that we're trying to kind of break down barriers as much as possible.